Good evening, all of you. How are you all?
We have in last class we have discussed about managed care now. We we have covered up to HMO, PPO, and POS. And do you asking me to explain?
Yes, what else? Apart from this, still what else we have covered?
From the first day, we have covered about Medicare, Medigap coverage, Railroad Medicare, Medicaid, Blue Cross Blue Shield,
Mm-hmm.
workers' compensation, commercial insurance,
Mm-hmm.
and then managed plan.
I come again. Marriage. What did you say?
Ma-
Come.
Managed care, ma'am.
Managed care. Okay. Can
Yeah.
someone explain about managed care?
Ma'am, this is Deepti.
Yes, Dipti.
Uh, Last class we have discussed about managed care. Coming to managed care, it plays it helps the patients to pay larger portion of their patient's bill when comparing to the commercial insurance. In
Mm-hmm.
managed care, we have three types: HMO, PPO, and POS, Health Maintenance Organization Plan, Preferred Provider Organization, and Point of Service.
Okay.
HM, Coming to HMO, it is a plan which consists of network of physicians, hospitals, other healthcare providers who are enrolled or contracted in certain insurance companies.
Mm-hmm.
Uh, The patients are taken care by the primary care physicians. If there is
Mm-hmm.
any requirement, the patient should be moved to the next physician or higher physicians. It offers lower premiums, especially affordable for people who only need general medical care. And then
Which
coming to
one?
people,
Which one?
HMO, ma'am.
HMO. Oh.
Yes.
Okay.
Uh, Coming to PPO, it is
Mm-hmm.
preferred provider organization. As it is said by that name, it has specific organizations.
Mm.
This offers coverage through a network of selected healthcare providers, such as hospitals and physicians. It gives more choice to patients to choose the provider. It is larger than the HMO and also point of service too. It is also called as expensive managed care plan. And then point of service, ma'am. It
Okay.
charges in between HMO and PPO charges. It offers more provider choice. And with point of service plan, we pay less. We can say that it is not too much cheap or not too more expensive.
Thank you, Deepti. So, anyone else? Thank you for remembering those topics. Did you just looked into your notes, Dikti, or
Managed care.
Railroad Medicare? Not managed care. Railroad Medicare. Can someone explain? Not you, Deepti. Others. Others. Megha, Priya, Prasanna, Ruth Mary, Balu.
I'm telling about Railroad Medicare, ma'am. It is a Medicare plan for railroad retirees, ma'am,
Mm-hmm.
and it is administered by Railroad Board, ma'am.
Mm.
It's a, it provides services for the retired people in the railroad.
So, can someone explain about Medicaid? What is Medicaid? And eligibility as well.
Medicaid is a government health insurance plan. It is operated by state government, so called as a federal plan, and it provides facilities and a health insurance plan for patients with less income, those who can't meet up medical expenses.
Hmm.
And the eligibility criteria for Medicaid is low income families and daily wage working people, infants born to pregnant women, and disabled persons.
Not woman, it's women.
Infants born to pregnant women,
Yes, pregnant women and
disabled persons. Yes, ma'am, I am already told about Medicaid, ma'am.
okay. Then what about commercial insurance?
Commercial insurance is a private plan. It offers more than health insurance.
Hmm?
And the main goal of this commercial insurance is making up money. It works for the profit, and it does not involve any government.
Mm.
And in this, there are two types of plans, that is individual plan and a collective plan. Sorry, group plan.
Mm.
Individual plan is purchased by individuals And the group plan is brought by some also called as collective plan. It was purchased by a group of people.
People with suffering from chronic renal disease people.
Okay, explain like what? Renal disease. Could you explain in detail about it, or at least in brief?
Renal disease is a kidney failure. More alcohol or drink, kidneys fail. It stop working to filter blood. Kidney is a most important part in our body. Commonly అదే పల్లి
Yes,
కామన్గా
Balu.
రెంట్.
Blue Cross Blue Shield. Anyone? Can anyone?
I think Blue Cross is a animal purpose.
Here, Balu. So we have already discussed here about this is one of the plans. So Blue Cross Blue Shield. Okay.
Blue Cross Blue Shield.
Yeah. Did you listen to this class when I was explaining about this topic?
No, 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 no.
No. Okay. At the time you have a network issue, I guess, right?
Yeah, yeah, yeah. The Blues is a United States based foundation.
Non-profit plan, ma'am.
Non-profit plan, not for
It's
Blue
profit.
Cross
the
Yeah.
Blue Shield is a
first
formed in
private organization.
Yes.
1982.
Anyone?
Most
Yes.
first private organization. It's like a service thing.
One of the. Come again. Who is
First private
explaining?
organization. Most.
Balu, could you please mute yourself? The noise is from whole side. Come on. Who is explaining just before? Blue Cross Blue Shield, not for profit, and one of the first private health insurance organization.
Ma'am, it offers health insurance to more than 70 different organizations. Ma'am.
Mm.
And also it is located in every state in the US.
Mm-hmm.
Mm,
Good.
and large population are enrolled in this Blue Cross Blue Shield, ma'am, because it is located in every state. Many people are enrolled.
Mm.
It is the one of the first private health insurance organization,
Yes.
non-profitable organization, and it is complete serving organization.
Okay.
Mm,
Okay. What is managed care? What is managed care?
Uh, Earlier I said, ma'am, that it offers a larger portion of the patient's bill, ma'am, comparing to the commercial insurance. It pays a larger portion of the patient's bills, ma'am. It offers larger portion of the patient's bill, ma'am,
Mm-hmm.
comparing to the commercial insurance.
Mm-hmm. Okay. So thanks, everyone, reminiscing those topics, like remembering those topics and coming forward to
Okay,
explain.
ma'am.
Yeah,
Okay,
make sure
okay.
that every day you are being active and yeah,
Okay,
let's be interactive like this and learn things.
okay, ma'am.
Okay.
Okay, ma'am.
Yes. Anything else?